Hello and welcome to Healthcare Matters, the internet television program that explores the intersection of medicine and the law. I'm your host, Mike Matre, and today's guest is Dr. Richard Anderson. Dr. Anderson is the Chairman and Chief Executive Officer of the Doctors Company, the nation's largest physician-owned medical malpractice insurer. Welcome to the program, Dr. Anderson.
Thank you very much. Nice to be here.
The patient is generally a layperson, and discussing defensive medicine with other lay people, I often get the response that if there's a chance that I have a specific condition or ailment, I want it tested for. If there's any benefit I want it, better safe than sorry. How would you respond to that patient who wants to make sure every avenue has been covered?
It's easy to understand the sentiment that I don't want any stone left unturned, and I wouldn't want it unturned if anything not appropriately investigated or treated if it was for me or my family or my loved ones. Very understandable sentiment. But obviously, but taken to its logical extension, you can see that it actually doesn't make any sense. Nobody wants everything done. In other words, nobody goes into the hospital and saying, give me your 10 best operations. And no one goes into MRIs and says, I'd like to have an MRI of everything. And so we understand that intuitively the best medicine is not everything. The best medicine has to be the medicine that's appropriate for the condition. And again, there's two reasons, but so beyond that, aside from the waste of time and resources, both of which are significant because medical takes a lot of the patient's time, and of course it takes a lot of society's resources to do almost anything in medicine today. So that we understand the significance of that waste. But it's well beyond that. The cost of defensive medicine is well beyond that because there are risks to any medical procedure. We say that, for example, an imaging study, whether it's a chest x-ray or a bone scan or a CAT scan or an MRI, the actual risk is quite low, but it's not zero. But even if you chose to ignore the relatively small risk of the procedure, itself, the problem is when you order a test that isn't indicated, you may get the answer to a question that you didn't ask. For example, if you order an unnecessary CAT scan of the chest, or you order millions of CAT scans of the chest in the hope of finding something sometime, you will end up finding hundreds, if not thousands, of small, questionable abnormalities that, once discovered, require further investigation. And so the patient will now start down a road of having investigation of a tiny nodule of uncertain consequence, whose presence was not known, which was not symptomatic, we shouldn't have been looking in the first place. And yet, patients will end up having biopsies, anxiety, costs, additional studies, sometimes even surgery, for a nodule that in fact has no clinical significance whatsoever.
Okay, so what you're saying is it actually has the opposite effect. Defensive medicine, rather than reducing risk, actually increases risk.
Right, because you can. I mean, no matter how good and how risk-free or how much risk reduction we do in medicine, there's virtually nothing that we can do that has zero risk. And so the more tests we order, the more therapies we give, the more medications we take, even if they're inherently good medications when prescribed or given appropriately, they all have an inherent risk. And when we're dealing with our own health and our own future, then taking unnecessary risk is a very dangerous thing to do, particularly when we're really talking about lottery-sized numbers. In other words, on any given test, the odds of a major reaction are relatively small, regardless of what the test is, or even the operation, relatively small. But we're not talking about should society order one extra CAT scan this year, for example. We're saying, would it be a problem if we ordered 1 million extra CAT scans this year? Or if we ordered 100 million extra blood studies, and it turns out that only 0.01% of those had false positives? Well, 0.01% times a big number is a big number. And those false positives are dangerous, or those 1 in a million allergic reactions. As soon as we order 1 million tests, somebody is virtually sure to have an allergic reaction. So again, it's impossible to have risk-free diagnosis and treatment in today's world.
Dr. Anderson, thank you for taking the time to visit with us today.
Well, thank you very much. It was a great pleasure. Thank you.
Recently, the BMJ, the International Peer-Reviewed Medical Journal, published a study of Florida physicians where it correlated that physicians who spend more money conducting tests and procedures for patients were less likely to be sued for medical negligence. Do you agree with the premises of the article, and why?